Hi, Roy again. So people ask, what are my options for hormone replacement? Well, it depends on if you're looking at synthetic hormones or the bioidentical hormones. In terms of synthetic hormones with men, we have the choice of the testosterone gels that you read about in the magazines, newspapers, or injections. Trouble with the gels is they don't raise the blood level very high, and you got to put it on every day. So you kind of go in like this. Whereas the injections using synthetic hormones, your blood levels go high for about a day or two, then they come back down and then go back up with another injection. So with the synthetic ones, for men, they got to do the injections frequently, 2-3 times a week to get benefit. With the ladies, the options for hormone replacement are limited also. They have the creams they can put on, they have the troches they can suck on, and there's pills they can take. And the trouble with the creams and the troches is your blood levels, again, don't go very high, and you got to repeat that every day. So you're kind of going like this. And with the synthetic pills, particularly like the progestins, a lot of complications from those. Whereas if you go to the bioidentical hormones, which is used most often in Europe, again, there's several options. You have the creams to put on, you have the troches to suck on. The trouble with the troches, with the bioidentical hormones, is they cause a lot of complications with the gut, and it's what's called leaky gut syndrome. And again, the creams you got to apply every day, and your blood levels are just going up and down very little. The other option with the bioidentical hormones, and this is what we use in our clinic and several other clinics here in Billings area, are pellets. And they're like a grain of rice that go up into the skin, most often on the posterior part of the buttocks. And the nice thing about those for women, they only have to be placed every 3 to 4 months. And for men, it's every 5 to 7 months. The difference between men and women is men get a lot more pellets because we got to get our blood levels higher. But what happens is you put that pellet in, your blood level goes high, and then it stays high for 3 months for women or 6 months for men, then it comes down. And you put them back in the next week. When it comes down, it goes back up, and you have much higher blood levels, and it's more sustainable, and people feel a lot better. So those are the options for replacing hormones in this country and Europe. Hope this helps. Talk to you later. You know, I prefer the pellets because I've tried the injections for testosterone with me. I didn't feel any better. My wife tried the troches and the creams, and she didn't feel any better. We've been on the pellets for almost 4.5 years, and it's wonderful. So thank you for your time. Talk to you later. Bye.